Gentlemen, if you finish faster than you want during sex, the answer isn't just to relax more or think about something else. Premature ejaculation isn't a willpower problem. It's partly a nervous system problem. And once you understand what's actually happening in the body, it becomes much easier to know what to do about it. I'm Junichi Swope, a men's pelvic floor physiotherapist, and in the clinic, I see men every day who deal with pelvic pain, erectile dysfunction, premature ejaculation, and sexual performance concerns. In this video, I'm going to explain the ejaculation reflex, why the sympathetic nervous system matters, and how erections and ejaculations are controlled differently, and the practical strategies that you can use today to improve control. One of the biggest things that I want you to take away from this video is that premature ejaculation is common, it's treatable, and it does not mean that something is wrong with you as a man. It usually comes down to a mix of arousal sensitivity, nervous system regulation, pelvic floor coordination, confidence, and sometimes medical or relationship factors. So let's break it down. To explain this, your autonomic nervous system has two main branches, the parasympathetic nervous system and the sympathetic nervous system. The parasympathetic system is more involved in erections. It helps the smooth muscle in the penis relax, supports nitric oxide release, allows blood vessels to open, and it helps blood fill the erectile tissues. The main physiological takeaway is that an erection is mostly parasympathetic. Ejaculation, on the other hand, is mostly sympathetic plus a spinal reflex. Now that's a very simplified version, but it's helpful to know. So for an erection, we need a certain amount of safety, arousal, blood flow, and relaxation in the penile tissues. This is why people often say the parasympathetic system is the rest and digest, or in this case, the rest and erect system. Ejaculation is different and very much driven by the sympathetic nervous system. Ejaculation happens in two major phases, the emission and expulsion. During emission, sympathetic nerves from the lower thoracic and upper lumbar spinal cord help contract structures like the vas deferens, seminal vesicles, and prostate. This moves semen into the back part of the urethra. And once the semen reaches that area, stretch and sensory signals help trigger a spinal reflex. Then the expulsion phase happens. This involves rhythmic contractions of muscles around the urethra and pelvic floor, including muscles like the bulbocavernosus. This is why ejaculation can feel like it reaches that point of no return. Once emission has happened and the spinal reflex is triggered, it becomes much harder to voluntarily stop. So the goal with premature ejaculation is not to magically shut off the reflex at the very end. The goal is to get better at recognizing and regulating the buildup before you hit that point of no return. The sympathetic nervous system is involved in the activation side of arousal. That doesn't mean sympathetic nervous system activity is bad. You need it for ejaculation, but if your system is very quickly shifting into a high arousal, high threat, high pressure state, ejaculation can happen faster than you want. Some research has found markers consistent with increased sympathetic activity in men with lifelong premature ejaculation. Although this doesn't mean that premature ejaculation is only caused by anxiety or only caused by the nervous system. Clinically, I explain it like this. Your ejaculation reflex is partly controlled by the nervous system, including the sympathetic branch. So treatment has to not be about trying harder to relax. It's about lowering overactivation of that sympathetic nervous system, improving arousal awareness, reducing sensitivity when you need, and increasing control before you reach that point of no return. That is a much more useful and less shame-based way to think about it. So first, we need to figure out what kind of PE you're dealing with. Before jumping into exercises, ask yourself, has this been present since your first sexual experiences, or did it start later? If it's always been there, that's often called lifelong premature ejaculation. That distinction matters. Acquired PE can sometimes be linked with erectile dysfunction, pelvic pain symptoms, thyroid issues, medication changes, stress, relationship difficulties, or performance anxiety. So if this is new to you or it came on suddenly, it is worth speaking to a physician or a qualified healthcare professional. And if you have erectile dysfunction, you gotta treat that very seriously and go see your family doctor. For men with erectile dysfunction, a lot of men will rush because they're worried they'll lose that erection. In this case, the PE is sometimes secondary to erection anxiety. For this, only working on lasting longer may miss the real driver. The 2026 EAU guidelines note that for acquired PE, treating underlying causes such as erectile dysfunction, prostatitis, lower urinary tract symptoms, anxiety should be the initial goal. So now that you're a little bit aware of what's going on, what do you actually do about it? Again, the goal is to not shut off ejaculation. The goal is to recognize the buildup earlier, lower the intensity when needed, and build more control before you hit the point of no return. Here are the main strategies. Strategy 1. Learn your arousal scale. Stop thinking of ejaculation as an on and off switch. Think of arousal from 1 to 10. At a 4 to 5, you're aroused but you're in control. At 6 to 8, you're getting close. And at 9, you're usually near the point of no return. By 10, ejaculation is happening. Here's the key. Most men try to gain control at 9.5, and by then, it's usually too late. Instead, your job is to learn what your 6, 7, and 8 feel like. Pay attention to those warning signs. If your breathing gets shallow, your body starts bracing, or your mind starts to panic and rush, those are moments to slow down, pause, breathe, or switch positions. Strategy number 2, stop, start training. This is one of the most practical ways to build self-control. During solo practice or partnered sex, stimulation continues until you reach about a 7 or a 10. Then you stop or reduce stimulation until your arousal drops back down to a 4 or a 5. Then you start again. The point is to not do this forever. The point is to teach your nervous system that arousal can rise and fall without automatically ending in ejaculation. This is especially helpful because premature ejaculation often happens when the body goes from high arousal to reflex very quickly. Strategy 3. Stop clenching your pelvic floor. A lot of men assume that they need a stronger pelvic floor to last longer, so they start doing tons and tons of Kegels, but Kegels aren't automatically the answer. If your pelvic floor is already tense, guarded, or overactive, clenching can make things worse. Instead, men need to learn how to soften and coordinate the pelvic floor. During sex or solo practice, notice, are you holding your breath? Are you clenching your abs? And are you clenching through the pelvic floor? If that's a yes, try slowing your breath and letting the area between your sit bones soften slightly. The goal is to have a responsive pelvic floor, one that can contract and relax and not stay stuck on this high tension mode all the time. Strategy 4. Downshift before it's too late. Breathing won't automatically cure premature ejaculation, but it can help calm the high arousal state that your body's trying to push towards. Try this. Inhale for 3 to 4 seconds. Exhale slowly for 5 to 6 seconds. Let your jaw, belly, glutes, and pelvic floor soften as you exhale. Again, don't wait until you're at that 9.5 out of 10 to do this. Use your breath when you notice yourself moving from 6 to a 7 or a 7 to an 8. Strategy 5. Evidence-based add-ons when needed. Sometimes behavioral strategies aren't enough on their own. That doesn't mean you failed necessarily, it just means that you may need another layer of support. If penile sensitivity is a major trigger, talk to your family doctor about topical anesthetics like lidocaine or lidocaine-prilocaine products that can help by reducing sensation and delaying the reflex. SSRIs are among the most commonly studied medication options for premature ejaculation. Some are taken daily, and some are used on demand. These medications can be effective, but they can also have side effects, and the information in this video is in no way an endorsement that these are appropriate for you. This is a conversation to have with your family doctor, and if anxiety, shame, relationship pressure, or performance fear is part of the cycle, sex therapy or psychological support can be very helpful. Because sometimes the body is not just responding to sensation, it's responding to pressure. So here's the key takeaway. Premature ejaculation is not a willpower problem. It is a reflex involving your nervous system, your sensitivity, your pelvic floor, arousal levels, and your brain. And that is actually good news, because that means there are multiple ways to work on it. If you suspect you have a tense pelvic floor, click this video over here for a 5-minute home stretching routine that requires no equipment and that anyone can do. And if you found this video to be helpful, hit that like and subscribe button so we can continue to destigmatize the information that men might need. Thanks for watching.